video is going to focus on the hip bones, but we are now going to call them the coxal bones. So the coxal bones are actually three bones in one, but we don't see any suture lines on them like we've seen in some of the other bones because the coxal bones fuse together during fetal development. So let us take a look at, these are how they would sit in the body. This is where they would join together. And if we pan over to this guy, we can see how they sit in the skeleton. So I'm going to do all of my explanations on the right coxal bone. So let us look on our worksheet and find the three coxal bones that make the three bones which make up the coxal bone. So the ilium is the top. The ilium is the most superior portion. The ilium is going to be the big flared out portion. It is going to be the largest portion of the three bones. Then we go to the ischium. The ischium is the back portion. So it's posterior and inferior. And that's kind of what you sit on. And then here, what I'm covering over with my hand is the pubis. So the pubic bone, the pubis is going to be the anterior bone. That's going to be in the front. Only the two sides of the pubis are what join together. They articulate with a pad of cartilage in between them. So let us now look through the parts of the ilium. Remember, ilium is spelled I-L-I-U-M, not I-L-E-U-M. So I-L-I is in the hip, I-L-E is in the digestive tract. So ilium, we start at about here, so about here and up is going to be the ilium. If we look over here, about here and up will be the ilium. So let us now look at the parts. So this part here is the iliac crest. So the iliac crest is just going to be the top part of the ilium. Then we have, if you look on our list, we have four spines. Actually, we're going to have a fifth spine when we go down a little lower. But these spines are named for their directional terms. So we have two spines here and two spines here. So if we look at the two here, these are going to be in the anterior portion. Remember, I'm holding it in correct anatomical position to myself. So these are the two anterior spines. This one's upper and this one is lower. So we just kind of combine all those words. This one is going to be anterior superior iliac spine, anterior inferior iliac spine. Okay, let's switch them around here, and now remember this is towards my back. So this would be the posterior superior iliac spine and the posterior inferior iliac spine. So those are your four spines. So just keep in mind that you have to hold this so that this flatter portion is in the front. Remember, that's where they come together. These 2 points are going to be anterior. These 2 points are going to be posterior. And then these two are going to be superior, and these two are going to be posterior. And then you can kind of put it all together. Okay? Then we have this huge curvature here, this huge notched out place. That's called the greater sciatic notch. So greater sciatic notch there. We have this nice depression here in the wing of the ilium, and this is called the fossa. Okay, you can see it's scooped out, so that's called the iliac fossa. That's a nice deep depression there. And then this nice deep socket is called the acetabulum. So the acetabulum is actually a part of each of the three bones. So this would be part of the ilium, this would be part of the ischium, this would be part of the pubis. But acetabulum means vinegar cup. Think of a cup full of vinegar, and that's what this is named for, so acetabulum. Okay, now we're going to go on to the ischium. The ischium is in the back part. It is posterior. So the ischium is posterior. You sit on your ischium. So if you've ever had a kid sit on your lap and wiggle around and they're digging into your thigh, you're like, ah, your ischium is digging into my leg. So you sit on your ischium. That's kind of your butt. So let's look at the parts of that according to our list. So the first, so remember, we're still holding it in correct anatomical position. So we have ischial spine. So the ischial spine is posterior. If we come out of our greater sciatic notch, we come into our ischial-spine. Okay? Then we have our ischial-spine. So greater sciatic notch, ischial-spine, and then down here is going to be the ischial tuberosity. So the ischial tuberosity is actually the point of your hip. That's what you sit on. So that will be the ischial tuberosity. And then this round hole here is going to be the obturator foramen. So the obturator foramen is the only hole that we have in the hip, and that is called the obturator foramen. Okay? So the next thing is the pubis. The pubis is anterior, so that is in the front. The pubis is where they come together. And the only thing we need to know on here is this flattened area where the two come together is called the pubic symphysis. So symphysis means, together. We live in symphony together. That is where we have the pubic symphysis joined together. So if we look up at this guy for a minute, so the pubic symphysis has a pad of cartilage that's in between those two, kind of absorbs shock, allows you to have some flexibility in that area. So let us review again one more time. So this is the ilium. Okay, so the ilium has this is the coxal bone as a whole. The top portion is the ilium. We have the iliac crest. We have the anterior superior iliac spine, the anterior inferior iliac spine. Back here we have the posterior superior iliac spine, the posterior inferior iliac spine. We're going to go down into the greater sciatic notch. The greater sciatic notch leads us down to the ischial spine. The ischial spine leads us down into the lesser sciatic notch. And then we will flip over here, see the iliac fossa. Over here we have the acetabulum. Back here we have the ischium, with the ischial tuberosity that you sit on. Obturator foramen, our nice hole here. The pubis in the front, and then the pubic symphysis where we come together. So that is it for the coxal bone.